Hello, my name is Ramphal, and I choose to do my presentation on the medical effects of alcohol on pregnant women in the USA. Also, this presentation will discuss fetal alcohol syndrome and some of its related effects. The researcher states the following: according to the American College of Gynecology, pregnant women should not drink any form of alcohol as it has been shown to cause serious and negative effects of the development of the baby. In the United States, exposure of alcohol to the fetus is the most common cause of babies born with birth defects and intellectual disability. Exposure to alcohol during pregnancy causes damage to the brain, and these are absolutely preventable effects. Alcohol in pregnancy. Alcohol include wine, beer, liquor. It is a leading preventable cause of birth defects in the USA. The figure shows that every 10 pregnant women reports alcohol use. During the first trimester, it is the most critical time because the brain is very sensitive and alcohol consumption can cause abnormal features. During the second trimester, fetal distress is related to binge drinking and miscarriage is a major risk. During the third trimester, it is when the fetus undergo rapid and substantial growth, and use of alcohol can interrupt that growth. When a pregnant woman drinks alcohol, some of the alcohol easily passes across the placenta to the fetus. The body of the developing fetus does not process alcohol the same way as an adult does. The alcohol is more concentrated in the fetus, and it can prevent enough nutrition and oxygen from getting to the fetus vital organ. According to many studies, alcohol use appears to be most harmful during the first 3 months of pregnancy. However, consumption of alcohol anytime during pregnancy can be harmful according to the guideline from the American Academy of Pediatrics. This video demonstrates the effects of alcohol on the fetus.
During pregnancy, the fetus receives all the nutrients it needs to grow and develop through the placenta. If a woman drinks alcohol, also known as ethanol, during pregnancy, the alcohol in her blood passes through the placenta to the fetus, posing a risk for fetal alcohol syndrome, or FAS. The mechanisms by which alcohol acts on and interferes with normal fetal development, and whether there is an amount of alcohol consumption which does not place the fetus at risk of FAS, are still largely unknown. It is thought the developing fetal brain may be highly sensitive to alcohol. During normal neurotransmission, neurons release chemicals that bind to receptors on other neurons, thereby propagating a signal. Ethanol may block certain receptors in the fetal brain, which can damage neural tissue. Another theory is that ethanol may constrict blood vessels in the umbilical cord, impairing blood flow to the fetus, thereby decreasing the amount of nutrients essential to fetal growth. FAS can cause lifelong mental and physical defects for the fetus. Some characteristics of FAS may include low birth weight, facial abnormalities, small head size, organ dysfunction, behavioral problems, mental retardation, slow growth, and poor coordination. There is no known safe amount of alcohol to drink during pregnancy. Pregnant women should either not drink any alcohol or should seek medical advice if they have questions.
Facial characteristic of fetal alcohol syndrome. The earlier the diagnosis, the better the outcome. Talk to your doctor if you think your child may have fetal alcohol syndrome. Let your doctor know if you drank while were pregnant. A physical examination of the baby may show a heart murmur or other heart problems. As the baby matures, there might be other signs that help confirm the diagnosis. This include small upper, small undeveloped head, undeveloped ear shape, small eye opening and short nose, undeveloped jaw, thin upper lips, flat mid-face, low nasal bridge, and other issues, as demonstrated in the diagram on your left. Such children look different from peers and may become the target for bullying, not to mention their obvious problem with health and development. Any race or ethnic group could be affected with fetal alcohol syndrome, as shown in the diagram on your right. Other issue with fetal alcohol syndrome. During Drinking during pregnancy most probably would lead to the following issue during the fetus shaping and growth, as well as forthcoming problems with health and mental development of children that led to lifelong issue. To diagnose someone with fetal alcohol syndrome, the doctor must determine that they have abnormal facial feature, slower than normal growth, and central nervous system problem. These nervous system problems could be physical or behavioral. They might present as hyperactivity, lack of coordination or focus, or learning disability. Insufficient communication skill that led to problems with social adaptation in various environments. Inability to think logically, use analytic approach to something, lack of judgment skill. As the result, such people have lifelong problems of such kind as bullying at school, poor socialization, eventual isolation, and independent living, that is, living with a parents. Also, these children would have problems of getting or keeping a job, apparently because of their looks or appearance. Children with fetal alcohol syndrome are especially likely to develop mental illness of various kinds, a problem with violence and substance abuse later in life if they are exposed to violence or abuse at home. Moreover, treatment of various issues related to the subject costs 5.5 billion per year as of 2015 for the US healthcare system, which is a significant burden for the budget. The statistics about the situation in the US regarding pregnant drinking and issues related to it are frightening. The chart shows that expenditure for medical treatment for people with fetal alcohol syndrome grew from 2 million to 5.5 million within a decade. Also, the average lifetime cost for each child with fetal alcohol syndrome costs $3 million. Management of fetal alcohol syndrome. Study shows that avoiding alcohol and other substances during pregnancy increases chances to give life to a healthy child by 95%. Why would any mother drinking and hurting the future baby? This is a question every pregnant woman should ask herself before taking a glass of wine or a bottle of beer to the hand. The baby's future lies in those hands. While fetal alcohol syndrome is incurable, there are treatments for some symptoms. The earlier the diagnosis, the more progress can be made. Depending on the symptoms a child with fetal alcohol syndrome exhibits, they may need many doctor or specialist visits. Special education and social service can help very young children. For example, speech therapists can work with toddlers to help them to learn to talk. Parents can also get training to help their children. Medicine can help manage symptoms like hyperactivity, inability to focus, or anxiety. A child with fetal alcohol syndrome needs to be watched closely to see if they need treatment to be adjusted. Children with fetal alcohol syndrome will also benefit from a stable and loving home. They can be even more sensible to disruption in routine than an average child. These children do well with a regular routine, simple rules to follow, and reward for positive behavior. I cannot stop emphasize there is no safe amount of alcohol that pregnant women can drink, and there is no time during pregnancy when it is considered safe to drink alcohol either. To all pregnant women out there, please do not consume alcohol of any form during pregnancy. This is because for the safety of the baby future. Thank you. These are some of the resources I used to complete this video.